Okay, so now that you heard all about my greatest skincare tips for people between the age of 20 to 30, really great skincare, double sunscreen, retinol every other night, a face pad in the form of alpha or beta hydroxy acid or both, and an antioxidant cream. At that point, you've got a really good solid skincare routine. So now what? Well, now you're in your 30s and 40s, and what do you do around then? You start thinking about injectables. You start thinking about, okay, with time and with age, overusing any muscle makes them big. So constantly frowning, constantly raising, constantly smiling makes these delicate facial muscles enlarged. And so that skin goes through the grooves of the muscle, developing the 11 lines or the etched in forehead lines or the etched in eye lines. You don't see them in me because I started that in my late 20s, honey. So what do I recommend? Botox for upper face to soften those muscles so the skin lies flat. And for the lower face, doing some little structural things, maybe a touch of filler to help with the scaffolding. Why? Because as we age, our body is trying to redistribute the calcium. And so they say, oh, old ladies shrink with time. But it's because the body is trying to harvest that calcium, right? So your skeleton at 35 or 40 looks very different than it did at 16. So what do? Deposit bony-based fillers to give it a little bit of a lift. And that's my best tips for people ages 30 to 40.